So here, this is right out of the book. This gives a chart of examples of different joints of the body and what types of classification they are. And this chart's not in the notes, but it's basically, that's just a summary of all the other material that's in here. But again, that's in the book. Anybody have the, you know what page that is?
258.
258. So here is, what type of joints are these here?
Sutures.
What's that?
Sutures.
Sutures, right. And then a lot of these are going to be synovial. Although here we have the cartilaginous or symphysis joints between the vertebra. And also the sternocostal or cartilaginous joints. And then we'll get into more different classifications of what types of synovial joints there are. Hinge joints. Yeah, question.
Do we consider the attachment of the ribs to be like joints, kind of, just because they're more mobile, or?
Well, they're not really mobile joints, but they are an articulation, so to speak. But they're more of a, they're not a freely movable joint.
Okay.
Although I think the ones, I'm sure the ones at the back part here might be more movable, because there is some movement in the ribs with respiration. You know, your ribs do move.
What about the sacrum?
As far as the individual segments, you mean?
Yes.
I'm going to guess that they probably start out like the intervertebral discs, and then those fuse to bone as in late adolescence, early 20s. So the question was about the sacrum, and so that's what I was saying as far as it starts out probably like a disc, like a vertebra, and then eventually it fuses into solid bone. And then here, now sometimes joints will change over time, like in the sacrum, but also here in the sacroiliac joint. Okay? It starts out as a synovial joint. It's more mobile in children, and then it tends to fuse into a fibrous joint in adults. So then, within synovial joints, there's different things to help reduce friction and help the joints stay mobile. So we'll talk a little bit about things called bursa. Basically, it's a flattened sac that is filled with fluid, and sometimes they can swell up, right? You can have bursitis or different types of things. Bursitis, you can have it on the elbows, over the kneecaps, different areas of joints that will have bursa that can be either inflamed or swollen. And the bursa are commonly found where tendons and ligaments cross the joints and where things are rubbing against bone. And then also, there's a particular type of bursa which is like a tendon sheath. And I don't know if I brought it with me today, but you've seen those little kids' joints where it's kind of a fluid-filled sac thing and you squeeze it and it squirts out. It's like a tube. Okay, those are kind of like a synovial sheath where the tendon goes through it, and then there's a synovial lining, a bursa lining surrounds it. And you can find that things like here in the tendons around the hand and wrist, around the ankle, things like that. Question? The labrum in the shoulder and the hip, they're like an extension of the joint. There's a bony part, and then the labrum is a cartilage ring that goes around it. It's kind of like the menisci also in the knee, where it's an extension to make the joint. What's that? Yeah. It's like typically in a ball and socket where it gives that little bit extra lift. Okay, other question?
Can we regenerate, or to what extent can we regenerate the synovial fluid inside the bursa if it gets pushed or?
Well, I don't think it's actually synovial fluid in the, oh wait, yeah it is. Yeah, okay, you're right, synovial fluid. Yeah, it's going to be regenerated because there's vascular structures that will go to the bursa that can help regenerate the fluid.
Okay.
Here's some pictures of some things. right there would be the labrum. So it's a ring that kind of goes around on the scapular side, or the glenoid side. Here's going to be the bursa. So again, here's a tendon, or in this case a ligament, where it's just a fluid sac that goes in between those structures to help lubricate it and keep things moving smoothly. And then here's the joint capsule, and there's some of those like tendon sheaths we're talking about, which is a modification of a bursa. And then now, joints have to be mobile, but they also have to be stable. Okay? And then the stability of joints are going to be controlled by the articular surface. Okay? For example, the shoulder joint and the hip joint are considered ball and socket joints, but obviously your shoulder is a lot more mobile than your hip is. So the hip has a deeper structure, so there's not going to be quite as much mobility as within the shoulder joint. Okay? And then also the knee joint, there's flat surfaces. There's a lot. If there wasn't strong ligaments that held the knee together, the knee joint would just be flopping around. So the surface of the joint, the actual structure of the joint is going to control how much movement, and then also the ligaments. Then also muscles are going to hold joints together as well. So there's a rotator cuff in the shoulder that holds the humerus into the glenoid labrum, or the glenoid fossa. So those muscles are going to hold it in. Their function is not so much mobility of the shoulder to move it around, but to hold it in stable so that muscles on the surface can move it. Can you get the skeleton out? All right, so as I go through some of these joints, we're going to talk more about palpation and how to feel different things. And as far as, there's some general concepts in this book here about palpation, but palpation is something that you need to practice. Okay, it's not about doing this, digging in. I'm going to feel this thing if it takes me all day, right? Down. So especially like in chiropractic school, there's things that you talk about with trying to train yourself for palpation, because palpation is really going to be more about a light touch. Okay, so like if you take a coin and stuff, obviously if you put it through phone book pages are pretty thin, right? So obviously you can feel it through one sheet, right? So then you can practice putting feeling it over a few more sheets, right? And then also, if you're using a light touch and you're doing really good at it, you can tell if it's heads or tails, right? And then if it's tails, now with all the new coins, if you can tell what state it is, then you really do. So you can practice stuff like that. And then the other thing is that if you can feel a hair under sheet paper, then that's pretty good too, especially if you're talking about a couple different sheets. So it's just the idea is that palpation is more about light touch rather than just feeling, trying to press real deep. Even if you're trying to feel a deeper structure, you feel it better with the lighter touch. So these are going to be plane joints, and a good example of those are the different carpal joints. All right, and now it's kind of hard to do this on yourself, but if you can palpate on another person, what you do is you sort of put your hand like this to kind of lock the carpals in, right? And then if you get on either side of one of the carpals, you can sort of move it back and forth. That's going to be a planar movement. So you have surfaces that are just gliding against each other. And again, it's something like that where you're not just really cranking it real hard. It's more kind of a subtle type of a movement. It's almost like if you have your hand on one side and you push on the other side, if you can feel it move on the other side. I mean, that's a movement that's kind of a little bit harder to feel, but just to give you an example of